All right, good afternoon again, everyone. Again, my name is Rashawn Thompson, and I'm really happy to have this opportunity to share with everyone here. It's actually my first time doing this sort of presentation, and of course, it's really exciting to make this sort of presentation among a group of persons who come from such diverse backgrounds and from so many different places. So, thanks for the opportunity as well. As I said earlier, I'm currently a student here at the University of Westminster, doing my master's in international media business. My professional background is in journalism. I'm from Jamaica. Before coming here, I worked 4 years as a radio broadcast journalist at a news organization back home. It's called Nationwide News Network. It's been a pretty exciting and enriching experience so far, but I'll speak less about my personal experience and more about health-related issues, incidentally, and how media back home have played a role in dealing with two particular outbreaks of vector-borne diseases in the last 2 years in Jamaica. So before I get into the substantive bit of the presentation, I'll just ask two questions. And the first is, how many of us in the room have heard about the Zika virus? Just about everybody. So how many of us have heard about Chikungunya virus? Okay, perhaps half the room. All right, so I've asked the question because I'm going to tell you a bit about Jamaica's experience with the Chikungunya virus from about 2014 and the Zika virus, which has been taken on much prominence, certainly in terms of media coverage in the last year or probably a couple of months or so. And the idea came out of a talk I was having with Katie last week, and I told her about a story I'd written from last year, May, about the Zika virus, and she was quite surprised that in Jamaica, the Zika virus was already getting such prominence, because when I came here to the UK, it was only the last 6 months or so that I saw that the Zika virus was making headline news, so to speak. So in 2014, okay, the Chikungunya virus, by the way, is a mosquito-borne disease. Like Zika, it is spread by the Aedes aegypti mosquito. And in 2014, there was an outbreak which was quite massive. Frankly, it became an epidemic in the region. And the virus had quite devastating impacts on Jamaica for a number of reasons, including the fact that our health system ended up being overwhelmed, and we never quite had the capacity to respond in the sort of way that would have been necessary to mitigate, contain the impact. Also, which has sort of been a consensus in Jamaica, is that the number one problem was lack of communication from the government. And it's fascinating because in the throes of the outbreak back in 2014, the government reported that they were actually preparing for an onset or introduction of the Chikungunya virus from 2 years prior. And frankly, whatever preparation was taking place was invisible. It was frankly a bit stunning. So, and of course that angered, many people in Jamaica. Now, how is it that we came to have this situation where there was such poor communication? One of the issues at that time, Stacey was talking a little bit earlier about how the political dynamics of societies can impact responses to health issues, citing the Nigerian case. At the time when persons were getting wind that there was an outbreak of this virus, the Chikungunya virus, the party that was then in opposition was the one that was really making alarm about it. And we had a health minister whose constituency, incidentally, was showing the first signs of huge numbers of people just taking down. And we had a situation where his opposition counterpart was the person raising the alarm. So it was embarrassing because the then health minister was caught almost flat-footed. And in a sort of response, which was, I suppose, arguably more political than health concentrated, his response ended up being to sort of downplay the impact of what was going on. And so that was the first thing that, or one of the first things that caused us to have such a lethargic, lackadaisical, slow response, because for all intents and purposes, there was a underreporting and downplaying of the impact and potential devastating consequences this virus could have had on us. Now, it was estimated that about 60% of our population ended up having chikungunya. Yes. And of course, I too got chikungunya. Yes. Oh, it's chikungunya virus, I'm calling it chikungunya for short. And it was so funny because I think I've experienced a number of different types of viruses coming to Jamaica, and I've just never quite been hit down. And then I quite remember that experience. I was doing my job as a journalist, going to work every day, reporting on how this was impacting our country. I went home one evening, and then I woke up, and I thought, well, my shoulder isn't feeling as flexible as usual. And then one of the funny things about chikungunya is that it comes on with such rapidity. Is that you literally could be quite healthy, fit at this moment, and in an hour and a half, you're like, what's happening with me? Yes, I remember I woke up the day and I wanted to go to the bank. My shoulder felt a bit stiff and it was just not moving the way I was used to. But I kind of put it on to perhaps I slept, poorly overnight. But then as I made my way to the bank, I just kept feeling worse and worse and worse throughout the day. And then the joint pain started, the fever started, and all the other symptoms, connected with chikungunya, just started. And I thought, oh my God, I can't believe, I'm one of them. But I suppose in a situation where 60% of your population ends up catching this virus, there's a significant chance I would have, been among them. To also give you a sense of how devastating the impact of this virus had been on Jamaica, we had a situation where it impacted our productivity hugely, because epidemics have a way of adversely impacting economic performances of different economies. And the Jamaican situation, of course, it was the sort of thing that we never needed. We're a country that's in the throes of the IMF program, for example. We have very tight fiscal space working with. And I remember the private sector organization of Jamaica back home did a very conservative estimate, saying that at a point in the outbreak, it had robbed us about $6 billion in GDP. And in the grand scheme of things, in terms of taking other countries, bigger Western countries, it may not seem so huge, $6 billion. But remember, Jamaica is a small island with a population of about 2.8 million people. So $6 billion meant something. And it was really, it ended up being a case where, for example, the health minister then was forced blatantly to admit that yes, there was an outbreak, there was an epidemic, and people were angry, and people were in pain, people were suffering. And it was quite an experience, to be honest, because I never quite knew a disease could just sweep across a country, well, it was a virus, could just sweep across a country like that. But also part of the story with these communicable diseases is that once they're introduced to a new environment, the possibility of it just moving through is much higher, as opposed to if there was a situation where they're in that environment before and then persons might have grown resistance or immunity some way, somehow to it. So that was part of the situation with chikungunya. Of course, it also caused complications which resulted in the deaths of a number of people. The virus by itself wasn't deadly and isn't deadly, but you end up catching it and you have a number of different issues dealing with. Was quite tricky. And the persons who suffered most were like pregnant women and the elderly. And persons who would have had like any form of joint pain before, oh, you would feel for them. I swear, my mom ended up having it as well, and it wasn't a nice experience. It was to see somebody just literally being good today and then just down in pain, another day. It was quite something else. And as I said, part of the huge issue was that there was this lack of communication on the part of the government. So within the context of that huge failure, it's almost as if the media back home started to lead the response in terms of the CHIKV, how we could respond as a country. And so the media back home was very instrumental in terms of helping to curb what was already a bad situation, to be honest. So several things were done by media companies, frankly, in terms of raising funding to fund money to fund a number of communication initiatives about what exactly this chikungunya virus that was so new to everybody was, what caused it, what could be done in terms of treatment. There was no cure, so to speak, so you really had to just live with it and treat it and allow it to run its course. There was no cure. Just a second. Right, so that was kind of the very stark situation back home. In light of this too, of course you could understand that there was this palpable call for accountability, because there was this strong feeling that our government had let us down big time. In Jamaica, we're not a country, sadly, that's very strong in accountability. Because if I take the UK as an example, where you have like a Brexit vote and nobody quite has to ask the Prime Minister to go, you just feel you've lost your authority, and the dignified, honourable thing to do is to go. Not quite in Jamaica. So the health minister, he wobbled along, and had the support of his Prime Minister. And I remember there was this interview, and a journalist asked the Prime Minister, well, we had a female Prime Minister at the time, well, Madam Prime Minister, don't you think your health minister should be held accountable? And her response was that, well, you know what, he comes in my constituency and helps me to clean up. People were really shocked at her response. But that, as I said, the media sort of took the central role in terms of leading the response, in terms of also coordinating eradication drives, because the key issue in terms of dealing with these vector-borne diseases is eradicating their breeding sites. So you want to get rid of that. There were a number of drama features that were done telling people how best to deal with this virus.
These were initiated by the Jamaican media themselves?
Yes. Yes, so like the organization that I worked with, for example, which is a private organization, it gets no government funding, absolutely. One of the things I should say is that Jamaican media back home, for the most part, we have a commercial media environment where it's very democratic, free, and pluralistic. There's not a case like in Nigeria, for example, where criticizing the government, one would be fearful of victimization. But within that free context too, there is this quite significant sense of public duty. So this was one of those times when the media really stepped in. And the government was really embarrassed, frankly, and on the back foot.
Into incentives, as you were asking. So you were asking Stacey about earlier the idea of incentives and what public duty.
Right, so it was a devastating disease which wreaked havoc on the country and its workforce. Productivity slumped, many people were reporting sick, schools were closing down, temporarily of course, but because there were such huge numbers of people who just couldn't make it out, schools closed for a number of days. And even when persons returned to work, they were performing well below standards, and employers had to kind of exhibit a sense of understanding of the circumstances. Sure.
to discuss that.
So that was the situation with Chikungunya in like about 2014. Let's fast forward now to like 2015, and it's been a totally different situation almost. With Zika, of course you'd understand that Zika virus. We tend to like abbreviations back home, we're a little bit lazy. So with the Zika virus, there was this greater sense of urgency. The health ministry this time around put our country on alert when there were only 16 cases of Zika in Brazil. Of course, Brazil has been the epicenter of this Zika virus outbreak. So that was one of the reasons why I could share with Katie last week that we were reporting on Zika from last year. And it ended up being one of those moments I felt proud coming from like a small island. And you see the BBC talking about Zika like 9 months later. Like, like we were way ahead. Yes, but I suppose it took on international concern as well because of the upcoming Olympics. But I've heard the stories about lots and lots of people like opting out of the game for fears of, for catching Zika. And we've learned a number of lessons, and I'm just going to run through some of them quickly that I've itemized. Just go to the top. So for example, from the onset, the ministry was able to, or took initiative in terms of having island-wide ongoing vector control programs, which included fogging. The ministry had teams out in the communities assisting persons and carrying out health inspections. There was a greater sense of a national effort this time around and a sort of multi-sectoral approach targeting various sectors of the society at the individual level, at the level of the family, at the level of the community, at the level of the workplace. And this time around it's been part of, to paint a picture too of the way in which we've been able to contain the Zika virus. Imagine Chikungunya 2014 when about 60% of our population ended up having the virus. That's about probably 1.8 million people, versus 2015-16, let's say, where up to last Wednesday, the health ministry reported that there were only 44 confirmed cases of the Zika virus in Jamaica. Of course, confirmed cases tend to be quite a number smaller than the reported cases, nonetheless. This time around, it does appear that the government hasn't made the mistake of seemingly under-reporting the gravity of the potential impact that the virus could have in the case of an outbreak. Important too is that it's done a better job this time of not being hasty in terms of dismissing concerns about persons complaining about ailments which might be symptomatic of Zika, because that was one of the problems with Chikungunya as well. I'm not sure if there might have been some amount of denial that, oh, it can't really be that we're in the throes of this epidemic. But this time around people say they're feeling certain effects, the government encourages them to go and get checked and stuff like that. So that has been a big difference as well. And just so we can get through one more quick one. I mentioned the private sector. Okay, the other thing too was that there have been sustained campaigns rolled out across several media platforms. The key traditional ones used heavily radio, television, and newspaper. This time around, for example, bulletins were issued well in advance of the first case being detected and confirmed. So when we had like the first case being introduced and detected, confirmed, we were almost ready. We weren't like taken by surprise, and we were more upright in terms of, no, okay, so we have our first such situation, let's respond, as opposed to like with Chick, we were like, whoop, and then aside from being surprised, a bit in denial as well. Information flow has been much more frequent this time around, and there's been like training of public health workers as well as journalists. Because before I left home, I came here in September last year, before I left Jamaica, I was one of those journalists who would have benefited from training provided by the health ministry in terms of reporting on these sorts of vector-borne diseases, and stuff like that. So.
We've got 5-10 minutes of questions, so go ahead, ask one.
I have a question, because in my country there was also an important outbreak, and it's interesting because the information first came from social media, because people started talking about those symptoms that they were getting and getting to realize that other relatives and friends were getting the same symptoms. And I wonder what was the role of social media in the case of Jamaica. And also, in Venezuela, for example, there were several important doctors that were pointing out the fact that some media outlets were ignoring the productivity part of getting the chikungunya, in the sense that even though you might be out of office for 2 weeks, you're also getting long life consequences. Like maybe you were gonna be you get unfit for several type of jobs, which is, I think, difficult to measure and to communicate, right? So yeah.
Okay, where social media is concerned, I think we would readily understand that social media, used mostly by millennials, tend to be so much ahead of the game in terms of the speed of communication and information sharing. So social media back home, especially in terms of Twitter, was one of those mediums that was used certainly in terms of just pillaring the government and demanding accountability. There was this, where Chikungunya is concerned, for example, there was this intense drive for accountability. But also, while there would be a lot of information sharing with social media, there was also a sense of caution, because many persons would take on acts that they really aren't suited for them, as if they're health or medical practitioners. So you also have to be careful in terms of the information you take from social media and how you treat with that. So a lot of persons would engage through and share through social media, but there was also this reliance on traditional media, because there's this feeling that at least traditional media, the persons behind them, would ensure certain fundamental journalistic principles are carried through in terms of fact-checking, dissemination of correct, appropriate information, that sort of thing. In terms of the consequences, you're absolutely right, because that's something I didn't touch on. Because certainly, there's still a lot left to be learned from Zika, so I can speak a little bit more in terms of the prolonged in quotes here, because it will only be 2 years' time, consequences of chikungunya. But you're right. So for example, there were cases where persons might have had the virus and fell ill, and then thought, oh well, I think I've been healed, and turn on to work. And then they find that they're having a second bout of issues to deal with. So that was a problem as well. And that was one of the ways, for example, bosses had to be able to show a greater sense of understanding and compassion with the situation.
How much more was the government involved with the Zika response than they were with the initial Chikungunya response? Because you said the media was very proactive in the Chikungunya, but with Zika, has the government been much more proactive?
Absolutely, much more proactive this time around. Because let me give you the example with Chikungunya. Chikungunya gained prominence because of increasing numbers of persons at the time just sharing similar experiences about this something, and at the point there was no name to this something, but they would be telling each other, this has happened to me, and this has happened to me, and this has happened to my friend, and this has happened to my son and my friend's friends. There was that kind of sharing until it became known that, oops, this is what was going on. With Zika this time around, way before it was being talked about, it was this new subject of discussion, the government, through the health ministry, had put the country on alert. So this time around, there's been a significant difference, even in terms of the government being proactive. So, and you feel a real sense this time that government is leading this time around.
Just following on from that, have there been any attempts to study, because I think one of the things that we've talked about is the difficulty sometimes to persuade donors that it's important to include media as part of a disaster response. And it sounds like Jamaica learnt that one the hard way, that there wasn't anything, and then the media stepped up and said, ta-da, and then, so it's two questions really, and the first one is probably just yes or no, which was, did the funding for journalism training come from the government? And secondly, is anyone studying the comparative response to Zika and Chikungunya as a media development example? Because if they're not, they should.
Make a great master's thesis.
It would make a great. It would make a great. It would make a great master's thesis, and it's the kind of thing that the sector needs to be producing to demonstrate to, to donors and to the sector. So there would be interest. I don't know. There'd be interest at Media Action. There'd be interest at interviews. There'd be interest at Thompson Foundation, etc. To see that kind of research if someone was able and willing to do it. And it sounds like it would be doable.
Yeah. As it concerns the funding for the media training and sensitization program, the one I was involved part of, for example, I think the Health Ministry staged that one, but certainly they got funding from organizations like PAHO, that's the Pan American Health Organization, and the U.S. Centers for Disease Control and Prevention, CDC. So those are two, and the World Health Organization, but I don't know that the World Health Organization was so immediate this time around in terms of link with Jamaica in particular, but definitely PAHO and the CDC, helped fund those programs.
Are all of those people easily contactable?
Sebastian?
Are all of those people easily contactable? Are all of the players in that process reasonably easy to talk to?
At the government level, fairly, yes.
Yeah.
In terms of PAHO, there's this other organization that I was trying to remember. It's called the Caribbean Public Health Agency, CARPHA. That's also another organization that was integral in terms of funding some of these regional initiatives across the Caribbean.
Can we email them and ask you all these questions?
I have a quick question, and if anyone has a last question, because we should probably let people go. It's like 2 o'clock. But I just thinking of media development really in action. What did your training look like with that as a journalist?
Incidentally, Stacey mentioned this information dump earlier. Unfortunately, it was a bit of that. So we were brought into fora a number of times, and it was mostly this offloading of information. There was opportunity for feedback though, and for interrogation, but it might have been very unilateral or kind of top down in terms of the way it was done. But I suppose that also presents an opportunity for us to learn how we can better open that forum and make it less staged so persons can really engage and exchange, Yeah, and discuss things, for example, like how different types of messaging may target and have better results towards different communities, for example, whether children or pregnant women or adults generally.